Patient Appreciation Week. I'm Nancy Higginbotham. I'm the practice manager here at Rousso Facial Plastic Surgery as well as the patient today. Super excited about this because chemical peels are my absolute favorite, or as we call it here, shedding the dead. So I am actually the perfect patient right now to get a chemical peel, as I've had a lot of sun damage from just being outdoors a little bit too much over the summer, and then also I've got melasma and this pesky mask acne, or as they call it, maskne. So I am super excited to shed several layers of my skin and have some fresh skin for the fall season. So this is our master esthetician, Ashley Strickland. She comes to us with 14 years of experience, including several years as with a derm.
Yes. It's been fantastic. So the chemical peel that we're going to be doing on Nancy today is called the Perfect Derma Peel. There are multiple different boosters that we can use with this. It is a medium depth medical grade chemical peel that we do here in the office. There is a booster specifically for acne to help treat and to help with the scarring from acne, the hyperpigmentation from it, melasma, sun damage, as well as texture, fine lines, and wrinkles. Typically, I recommend, depending on the level of concern that you present with, I usually recommend a series of 3, but you're still going to get great results even with just 1.
So a portion of this treatment demonstration is going to be live, and a portion of it is going to be pre-recorded because I want you guys to see my skin every day. I'm just going to take a quick snapshot of my skin day 1 through day 7 so you can see how much shedding that you're in store for.
So we are doing a booster on Nancy that is specifically for hyperpigmentation and melasma. The ingredients that are in this will also help some with the acne, but that's not what our primary focus is today. So we're going to get her cleansed really, really well. The reason that we chose a medium depth chemical peel is because of the level of damage that she has. We want to make sure that she gets a great result. So she will get a lot more peeling out of this than she would some of our other chemical peels. There are multiple types of chemical peels that we offer here in the practice, but this one is going to be the best for melasma and pigmentation.
So Ashley, can you do this chemical peel on your chest as well if you have sun damage and freckling?
It is not recommended. It has been done, but you have to be very, very cautious. I would never do that on a first-time chemical peel patient. The skin on the neck and the chest are much thinner than on the face, so you have to be very, very careful with those areas, but I usually do take it down the neck. So right now what we're doing is making sure that we have all of her makeup off of her skin. We want to make sure that we do a thorough cleanse before we get started. We will then use a toner to make sure that all of the oils are off the skin as well, so that the chemical peel penetrates evenly throughout the entire area that we're treating. So ideally, her biggest concern is really kind of right in this area, which is more of her acne scarring and her hyperpigmentation. So we're going to focus our attention in this area. We may do an extra pass right here depending on how she tolerates it. So one of the biggest differences in this booster over the acne booster, which Nancy was just asking me about, is this one is going to have hydroquinone in it, which is specifically designed to help with pigment. And the one that's for acne actually has more benzoyl peroxide in it to help specifically with the acne. So we're gonna try to do at least 2 to 3 layers of this, but it's gonna completely depend on how she tolerates it. I'm gonna start in the forehead and work my way around. The great thing about this particular chemical peel is that you can get pretty close to the eye with this one. So it really helps with those fine lines around the eyes.
So I'm just feeling a slight burn and a slight smell. So this is very tolerable.
So there is a numbing agent that is in this chemical peel. So after about the first 30 seconds, she's not gonna have any discomfort at all. So right now I'm just waiting to see how her skin tolerates the chemical peel. I'm looking for excessive redness, or what we call frosting, which literally looks like frosting on the skin. Once the skin reaches that point, we can't go any further into that area. So I want to make sure that she doesn't have any of that appears before we apply another pass. So we're finishing up our second pass. The first pass looked great. She didn't have any frosting. She has no excess redness. So this is the second pass. We're gonna just let this sit for another minute or so just to make sure that everything looks great. And then if her skin can tolerate it, we'll do one final pass. So we're about to apply her last pass. Her skin is doing great. We don't want to do more than 3 layers. She will leave this on for the next several hours. And the only thing that should change between now and the time that she takes it off is she may get a little bit more pink, but that's really about the extent of it. She shouldn't be in any discomfort whatsoever. So we just finished her 3rd pass. Everything looks great, but she does have a tiny bit of frosting right here. So this is where we generally stop. We would not go over this area again, even if it was only her 1st pass, because it means that we've reached the level in the skin that we basically can't go any further. But it's great over this area because she had an active pimple in that area, so it's really gonna help to minimize that. Okay, so we just finished her chemical peel. She's gonna leave this on for the next 6 hours, not touching or picking at the skin. After that, she's just gonna cleanse tonight with a really gentle cleanser. She's gonna go home with a little kit that has everything in it that she's gonna need, including 2 towelettes that are gonna help with the peel and the acne scarring and the pigmentation. There are specific ingredients in here that help with that. She's also gonna go home with a moisturizer that is gonna help with any itching that may arise and a sunscreen. The peeling itself should start in about 48 hours or so. And what you're not gonna do this time is pick at the skin.
She knows me so well.
Resist the urge to pick the skin. Once it starts to peel, which you'll be able to see as she starts taking pictures every day, it's gonna come off in sheets generally. So I usually recommend getting some little cuticle scissors to kind of snip everything off because you certainly do not want to peel the skin.